deal.
It is true. Here to explain is Dr. Michael Kaplan with Kaplan Sinus Relief. Hey, Dr. Kaplan, how are you?
Good afternoon.
So you are a local Houstonian, by the way. You went to Bel Air High School?
Yes, I did.
Austin?
Yes, I did. Great.
All right.
Yeah.
We love that. Well, what sets you guys apart from other places is you actually offer a sedation method to help people sort of relax a bit more. Explain that.
Absolutely. At Kaplan Sinus Relief, we offer the option of IV sedation, which means you come into the office, we put a little IV in your hand, and you get sleepy, you fall asleep, you wake up, it's over with, and your life has been transformed by opening up the sinuses, alleviating the congestion, the pressure, and the pain.
So is that kind of like taking you into that little twilight zone
Absolutely.
instead of putting you all the way to sleep?
Yeah, I mean, you are asleep. You feel nothing, and when you wake up, you remember none of it. That's amazing.
Huh. That's
don't remember any of it.
You don't
Oh,
remember
no.
things.
So you guys
No
are
ideas.
really busy at this time of year. Like, it was such a beautiful weekend. I was out. I know a lot of us were out.
Yeah.
And what's crazy is, like, you get in your car and you know how it's coated in that green pollen. A lot of people, this causes problems for a lot of people.
Sure it does. That green pollen is what stimulates your allergies, which is blocking up the sinuses, causing the pressure and the congestion. And at Kaplan Sinus Relief, we can alleviate those problems. And by dilating the sinuses, we alleviate the congestion and the pressure, even if you're out there exposed to that pollen.
And for a lot of people, it's not just temporary discomfort or a little bit of sniffling. For a lot of people, there's pain and pressure. It's chronic, so they almost are unable to focus on anything.
That's right. It's especially for those people who've been unresponsive to the medications or you're relying on the medications daily, weekly. There are options for that.
So let's talk about, like, when somebody comes in, sinuplasty can be something that might open up the door where maybe you have a deviated septum or some different things going on as well.
Certainly. There are plenty of people who come in and they've got either a deviated septum, enlarged turbinates, which are valves that can get enlarged and plugged up, or there are even patients who come in from time to time with snoring issues, and we can address those simultaneously. Yes.
Can you also have, like, vocal issues as well? Or sinus
It
problems?
can cause a chronic cough and some hoarseness, absolutely.
So for people who, we're looking at some video right now of the procedure. I mean, so sinuplasty, this is something you routinely do every single day. But for people who are unfamiliar with this procedure, explain to us how it works.
Imagine you have an hourglass. We all know what an hourglass is.
Yeah.
The top half of the hourglass is the sinus, the bottom half is the nose, and that narrow channel that connects the two, that's what drains the sinus. And here you see the balloon going through that narrow channel up into the sinus behind the forehead, and as the balloon inflates, it permanently dilates that narrow channel. But the beauty of it is you take the balloon out.
But it's like a millimeter, right? It's like teeny tiny how much that it inflates.
Yes, but you only need a small amount of inflation. It's 12 atmospheres of pressure. It permanently dilates that narrow channel. That narrow neck of the hourglass opens up permanently, and that's what alleviates the pressure.
Stupid question, the balloon comes out, right?
The balloon comes out.
So, Dr. Kaplan, when you say it opens up the sinuses there, it opens up that channel, does that just mean that the patient has a sinus that's able to drain so those congestion issues go away?
Exactly, Derek. The purpose of this is to obtain drainage where there isn't any. So by opening up that narrow channel and obtaining drainage, that's what alleviates the congestion, the pressure, the pain,
Headaches,
all of it.
And you actually train other doctors how to do this.
Yes, I am. I am a consultant for the company that makes the balloon, and I'm a teaching center of excellence here in Houston. And on any given week, I have 1 or 2 doctors from East Coast, West Coast, North, South. I've been training doctors since 2012 for this.
and we're seeing some video of your training right now. So you've been doing this for, what, 21 years now?
I've been in practice for 21 years. We've been doing this in the office since 2012. Probably dilated about 1,900 patients at this point.
And how routine would you say it is? I mean, for people out there who are freaked out by any sort of procedure, what is the recovery time like?
Most of these are done on Fridays. It gives people the weekend to recover. By Saturday, you're doing most of everything you need to do. And by Monday, you're back to work.
That's amazing.
Yeah,
and I mean, do your patients like have that initial, oh my goodness, right after surgery, oh my goodness, this is what breathing is like?
Many of them do. There's initially some congestion, but within a week or 2, you're beginning to breathe better than you have in years, and that's routine.
If someone out there is thinking, okay, I have some of these symptoms, but I'm not quite sure if I have a problem, I mean, how does someone know when the problem is severe enough for them to come and see you and have a procedure done?
When you're suffering from these symptoms that we mentioned, it's impacting your quality of life. You've been treated by your primary care doctor. You're trying the over-the-counter medications. You're either missing days at work. It's impacting your livelihood. that's the time.
So if you've been on like a series of antibiotics for sinus issues,
Absolutely.
you might want to think about.
If it's bothering you enough that you're thinking about it on a regular basis, that's the time to come in and see me.
Okay, so and those are some of the symptoms we're seeing there
Absolutely.
on the screen. So obviously nasal obstruction and all kinds of.
Nasal obstruction, congestion, headaches, pressure, even lightheadedness, chronic cough. Absolutely.
What I think is interesting is bad breath is one of the symptoms. Really?
Is that because of the drainage?
Because the drainage can drip down the back of the throat onto the tongue. It causes some bacterial overgrowth. It sounds kind of ooky and gooky. And, but yeah, those are some of the things we can alleviate with this
The
procedure.
technical terms of ooky and gooky.
That's right.
So who knew? Bad breath caused by sinus problems. Well, Dr. Michael Kaplan, thank you so much for stopping by.
Pleasure.
Very interesting conversation. And to schedule your appointment at Kaplan Sinus Relief, you can call 713-597-7433, or of course you can visit them online, kaplansinusrelief.com. And Dr. Kaplan, thanks again.
Thank you very much.
When we come back, how one local high school is fueling the future with their super mileage vehicle. Details on the big event they're competing in after the break.
If you suffer from headaches, nasal congestion, lightheadedness, or dizziness, consider balloon sinuplasty. I've personally performed over 1,500 of these procedures, and I've helped thousands of patients with chronic sinus infections. Balloon sinuplasty is covered by most major insurance plans. You will feel